Our first aim about sort of equipping carers for sensitive conversations is about developing tools to help identify and assess the needs of people with serious and advancing ill health. So what we want to do is develop some kind of resources toolkit along those lines, and get as many agencies but also peer networks involved in developing and trialing those resources. The second strand, so the short term aim, is about developing consistent advocacy for people who are navigating health and social care pathways. And ultimately, we would like that to lead to kind of cross-agency service standards around equitable care. What resources we need are information really that promotes supportive and inclusive care. So maybe, breaks down some of the negative stereotypes about what palliative care is, and how you need to be dry before you can go into a hospice, or nobody will understand you. So to provide some examples of good practice that we know are taking place, and to make much more explicit a commitment to anti-discriminatory commitment, because that's a lot of the fear, isn't it, that people remember how they were treated in the 80s, the 90s, and it's given them this general fear of health and social care practitioners. What we want to do is to disseminate that good kind of local, national, or maybe even some international practice across practitioner and peer networks, and again involve the partners to help sort of tailor resources, and spread the word amongst peer networks. The third aim is about ensuring that practitioners and peers feel better supported to work and live with serious and advancing ill health and substance use. And ultimately, this hopefully will lead to sort of better information sharing at a sort of strategic level. But for the purposes of our project, we're much more interested in that more practical kind of coordination of information, care focused information. So what input we want is about a kind of some care coordination, and with two sort of strands to that. So a peer focus and a practitioner fora. And I think we're thinking about those being separate forums initially. So it's about identifying people, peers and practitioners who would like to kind of lead on this area of palliative care and substance use, and bring them together to provide that forum where palliative care nurses are talking to hospital workers, are talking to drug workers, are talking to GPs. There's just a much more readily available sharing of information and advice and support. And then the fourth one is, in the short term, we want resources developing for families and carers so that they can access information and support much more readily, really to make them confident that inclusive health and social care is accessible, really, practically accessible to them. The resources that we need is to kind of find or help develop better support for families and carers, because we know of little nuggets of practice, but quite often they've been time limited. So we need to kind of explore the support that is available among agencies and peer communities, and hopefully garner some strategic commitment to supporting families, establishing peer support and resourcing those on a more sustainable footing. All the stories that we've heard from people over the years, once people are in palliative care, they get good care. It's getting them being able to access it in the first place is the huge issue. And our focus is about getting people into it rather than, adding a new level of demands onto the palliative care and all activity. We want to remember it's people using substances, it's the family carers, and it's the key workers that are our key kind of audiences. External factors about recognizing the stigma towards people using substances and how important that is as an influence, as well as the financial and resource pressures on services, and the political and commissioning environment.